morning.
Hello, good morning.
How are you?
Doing very good. How about yourself?
I'm doing good, thank you. My name is Niza-Valentin. I'm a nurse practitioner student, and I'll be the one taking care of you today.
Okay.
So for today, we're gonna do a test for the musculoskeletal and neurological. So before that, I have a questions for you. Okay? Do you feel dizzy, any nausea, vomiting,
No.
headache?
None.
Okay. Do you have any fracture anywhere else in your body? No. Okay. Any pain?
No.
Okay. Do you know where you are?
Yeah, I'm in the clinic.
Okay, and do you know what's the date today?
Yeah, November 22nd.
Okay, good. So I'm gonna wash my hands first before we start, okay?
Alright, perfect.
Already washed my hands. So we're gonna do for the neurological first. We're gonna do all the cranial nerves, okay?
Okay.
So we're gonna start first with cranial nerve 1, which is the olfactory. So with that test, we're gonna test for your sense of smell. Okay, so for this test, you're gonna close your eyes and occlude one of your nostrils, and you need to tell me what is the smell, okay?
Okay. Strawberry.
Good. Can you do with the other nostril?
Vanilla.
Okay, good. You got it right. And now we're gonna move on to the cranial nerve 2, which is for the optic nerve. And we're gonna test for your visual acuity using the Snellen chart. Okay?
Okay.
So I want you to cover your right eye and tell me the smallest letter that you can read. Okay?
LTFPH.
Okay. So do it in the other eye.
LTFPH.
Good. And now uncover and tell me.
LTFPH.
Good. Okay. Now we're gonna test for your visual fields. Okay. So I'm gonna wiggle my hand and you need to tell me you can see it. Okay.
Okay.
So cover your right eye.
Yes.
Okay.
Yes. Yes.
Okay. Do with the other eye.
Yes.
Okay.
Yes. Yes.
Okay. And cover.
Yeah. Yeah. Yeah.
Okay. Good. Now we're gonna move to the cranial nerve 3, which is the oculomotor, and we're gonna check for the direct and successful pupillary reaction. Okay.
Okay.
Okay. Okay. So I can see that both of your pupils are equally brown and reactive to light. Okay. Another test for cranial nerve 3 is the accommodation and convergence. Okay, so I want you to look on this pen light and look at on the farthest object that you can see. Okay, so look at here and then look at the farthest, and then look at again here. Look at the farthest. Okay, good. So I can see that your pupils constrict whenever you're looking at the near object, and your pupil dilate whenever you're looking at the farthest object.
Okay.
Okay, and now we're gonna test the 3 cranial nerves, which is the cranial nerve 3 oculomotor, cranial nerve 4 the trochlear, and cranial nerve 6 the abducens. So for those cranial nerves, we're gonna test for the conjugate gait and extraocular movement. Okay. So you need to follow the pen light. Okay. Okay. Okay, good. The next one. So uncover your right eye and look at there, and then uncover it. Good. And then here, uncover, cover it, and then uncover. Okay, good. Now we're gonna check for the fundoscopic. Okay. Okay, I'm looking for your right eye so I can see the red reflex there. Optic disc is sharp. No AV nicking noted. No macular degeneration. Now we're going to do the other side. Okay, so it's the same. You can see the red reflex. Optic disc is sharp. No AV nicking noted. No macular degeneration. Okay? That's good. So now we're gonna test the cranial nerve 5, which is trigeminal. So on that cranial nerve, we're gonna test two, like sensory and motor. So for the motor, we're gonna check for your masseter muscles. So I want you to clench your jaw. Okay, good. And then now we're gonna check for the sensory. So I want you to close your eyes, and I have a sharp object here and a soft. And you need to tell me where did I touch it, which is forehead, cheeks, nose, or chin. Okay?
That was a sharp forehead.
Okay.
Soft chin. Sharp right cheek. Soft nose.
Okay, good. Now we're gonna move on with the cranial nerve 7, which is the facial. So we're gonna test for facial symmetry. I want you to smile. Okay, frown. Raise your eyebrows. Puffy cheeks. Puffy lips. Okay, good. So everything is symmetrical. Now we're gonna do the cranial nerve 8, which is the vestibulocochlear, to test for your hearing. So I'm gonna whisper on your right ear, and you need to tell me what did I say, and I'm gonna do the same on the left ear too. Okay?
Okay. Banana.
Okay, good.
Apple.
Okay. Now we're gonna do the Weber and the Rene test. So I have here tuning fork. So I want you to tell me if you can still hear the sound. Okay?
Okay.
Okay. Can you hear it in the left and right, or both?
I hear both.
Okay, good.
Okay.
Okay, good. Now we're gonna do with the right ear.
Okay.
Okay, so it means that air conduction is greater than bone conduction, which is a good result. Okay, for the next one.
Yeah.
So it's the same. Air conduction is greater than the bone conduction. Okay, so that's normal. Now we're gonna do the cranial nerve 9 and 10. So that test, they're doing it together. So cranial nerve 9 is glossopharyngeal, and cranial nerve 10, which is the vagus. Okay, so open your mouth and say ah. Okay, so I can see there that your subpalate and uvula rise symmetrical. Okay, that's good. And now we're gonna do the cranial nerve 11, which is the accessory for the spinal. So I want you to go against the resistance. Okay, good. Then here, the other one. Okay, good. Now the last cranial nerve, which is the 12, is hypoglossal. So I want you to stick out your tongue. Okay, so it's in the midline, so it's good. Okay, so now we're done with the cranial nerve. So we're gonna move on with the, sorry, let me just put it here.
Okay.
So now, we're gonna move on with the upper extremities, the musculoskeletal and the neurological. So first, I'm gonna assess for the joints of your hand to check if there's any tenderness, swelling, nodules, crepitus, symmetry. So it's good. Now I'm going to check for the capillary refill. So your nail bed is pink. Less than 2 seconds. It's still pink. Now I'm going to assess for the radial pulse. Okay, so it's normal. There's no bounding of pulse. Next, I'm going to assess for the overall, color and warmth. Okay. Your skin is dry, warm to the touch. There's no abnormal discoloration. There's no lesion, mass, cyst. Okay, it's good. Now we're gonna do the range of motion. Can you do a flexion, like this? Flexion, extension, extension. Okay. and then abduction, adduction, and then thumb opposition. Is there any tenderness? Okay, good. Now I'm gonna assess for the strength. Can you squeeze my hand? Okay, so it's 5/5. Now we're gonna move on to the wrist. So I'm gonna assess your wrist first for any redness, swelling, symmetry, nodules, tenderness, crepitus, any tenderness?
No.
Okay, good. Now we're gonna do the range of motion. So flexion, extension, hyperextension, ulnar deviation, radial deviation, and rotation. Okay, any tenderness? Okay, good. So now we're gonna do move on to your elbow. So I'm gonna assess first if there's any redness, swelling, tenderness, crepitus, nodule. Okay, good. So we're gonna assess the range of motion. So flexion, extension, hyperextension. Okay, good. And I'm gonna assess now for the strength of your bicep and your tricep. So I'm gonna hold on here. Try to flex it. Okay, good. And try to extend it. Okay, with the tricep. Like that. Okay, good. So it's 5/5. Now we're gonna move on to your shoulder. So I'm gonna assess first if there's any redness, swelling, tenderness, crepitus, symmetry. Okay, good. Now we're gonna do flexion, extension, hyperextension. Okay, abduction, adduction, internal rotation, external rotation, and here, and circumduction. Any pain, tenderness? Okay, good. So we're gonna test now with the strength. So I'm gonna put like a resistance here and try to abduct. Okay, like that. Okay. Okay, good. And abduct. Okay, good. So it's 5/5. Okay. So now we're gonna test for the light touch sensation. So let me get my things first. Okay. So it's the same that we did with the face, but now we're gonna do it with the upper extremities. Okay?
Okay.
So I have a sharp object on top here. You need to tell me if it's left arm, right shoulder, left shoulder. Okay?
Okay. Left shoulder sharp.
Okay.
That's my right arm.
Okay.
Soft. Right shoulder pointed, sharp. And left arm pointed, sharp. None. It's soft. Left arm soft.
Okay. Good. Now we're gonna assess for the vibratory sensation. So I'm gonna check it for the proximal ulnar prominence. So you need to tell me if you can feel the vibration, okay?
Okay. Stop.
Okay, good. And now we're gonna do the cerebral coordination with a rapid alternating movement to check for coordination or equilibrium, okay? So first, we're gonna do the serial finger. So it's the same that you did with the thumb opposition, but this time it's gonna be quick, okay? Like this, quick, alternating. Okay, good. Next, we're gonna do the hand flip flop. So you need to tap on your, and then like that, okay? Okay, good, and try it here. Okay, good. And now we're gonna do the finger to finger. So I have here my hand here, my finger. So you need to touch my finger and then touch your nose.
Okay.
And then I'm gonna move it to another location and then touch it and then your nose, okay? Okay, now we're gonna do stereognosis. So stereognosis is a test to if you have the ability to identify the object that I'm gonna put in your hand. Okay, so this is like to test if there's like any brain injury. Okay, so close your eyes and then I'm gonna put on your right palm and tell me what is it.
Okay. Keys.
Good, correct. And the other one is gravitia. So gravitia is your ability to recognize the symbol. Okay, so I'm gonna draw on your palm, on your left palm, and you need to tell me what number I draw. Okay?
Okay. 8.
Okay.
6.
Good. So that's the test, like to test if there's any brain injury. Okay? And now we're gonna do the deep tendon reflex using a reflex hammer. Okay?
Mm-hmm.
So this test is to check for if there's any damage in the peripheral nerve. Okay?
Okay.
So at first, we're gonna do the brachioradialis. Okay, good. And then the biceps. Okay. And then the tricep. Again. Okay, good. And then now we're gonna do the patellar. Okay, good. And then the Achilles. Okay, and then the Babinski. Okay, good. So you have a good movement there. Okay, now we're done already with the upper extremities, and now we're gonna move on with the lower extremities. Okay, so we're gonna do first the hip. So I want you to lay down.
Okay.
Lay down, okay. Okay, so first I'm gonna assess your hip for any redness, swelling, tenderness, nodules, crepitus, symmetry. Okay, it's good. Now we're gonna do the range of motion. So flexion, extension. We're gonna do the hyperextension. Can you do the prone? Prone, no, prone.
Prone.
Okay, no, this one. Hyperextension. Okay, good. Now you can come back. Abduction, adduction, internal rotation, external rotation. Okay, good. And then the circumduction. Okay. Okay, good. Now I'm gonna assess for the strength. Okay, so I'm gonna try to put resistance here and try to abduct. Okay, abduction, abduction. Okay, and then adduction. Okay, good. Now we're gonna, so the strength is 5/5, which is good. So now we're gonna move on to your knee. So I'm gonna assess your knee first for any redness, swelling, symmetry, tenderness, crepitus, nodules. Okay, good. Now we're gonna test for the range of motion. Flexion, extension, hyperextension. Okay. And then now we're gonna test for the strength. Okay, so try to flex it. Okay, good. Try to extend it. Okay, good. So it's 5/5. Okay. So now I want you to stand up because we're gonna check for your spine. Okay.
Yeah.
Okay. So I want you to turn around. So I'm checking, inspecting, palpating if there's any, abnormal curvature. Any abnormal discoloration, lesion? You have any tenderness?
No.
Okay, good. And now, we're gonna do the range of motion, okay? So I want you to reach your toes,
Okay.
okay? Now while you're in flexion, I'm gonna check if there's any abnormal curvature like an S shape like that. If there's any scoliosis, so it's good. So there's no scoliosis. Then extension, hyperextension, okay, lateral flexion, okay, and then rotation, Okay, I'm just gonna put this. We're gonna check for the strength. Okay, try to do the flexion or rotation.
Easy.
Okay, yeah, like that. Okay, good. So it's 5/5, the strength. Okay. So now while you're standing, come here. We're gonna do some tests to check for your coordination or balance, equilibrium. So first, we're gonna do the Romberg test. So with the Romberg test, you're gonna walk, but with your eyes closed. Okay?
Okay.
Okay. Now you can walk. Okay. Good. Can you come back? Any dizziness?
No.
Okay. Now the next one, we're gonna do the pronator dip. So pronator dip is you're gonna do this for 30 seconds. And we're gonna check if like your arm is gonna droop or like supination. Okay, good. So everything is good. Now we're gonna assess your regular gait. So you just walk and come back. Sorry. No, you can come back like regular gait. Okay. Okay. There you go. Okay, now you're gonna walk using your heel. Okay, good. Now you can come back in. Now you can stay there. And then now you can walk using your toes. Okay, good. And now you're gonna walk heel to toe. Heel toe. Heel to toe. Heel toe. Heel toe. Good. So there's no imbalance there. Now it's good. And now we're gonna check for a deep knee bend. So I want you to come here and just sit like this. And then come up again. And try to do it again. Just to check your stretching of the muscle. So it's good. Any pain? Okay, good. Now we're gonna do the hip hop in place and hop in one foot. Okay, so hop in place first. And then okay, you need to hop in one foot. Try to hop in one foot. Okay, good. So we're good there. So now the last one, we're gonna do the lower extremities. Okay, so I want you to sit down here again. Okay, so at first I'm gonna assess your toes first for any redness, swelling, tenderness, crevitus, nodules, symmetry. So it's good. Now I'm gonna check for the capillary refill. So the nail bed is pink, less than 2 seconds, so it's good. Now I'm gonna check for your pulse. So it's gonna be the dorsalis pedis here. That's good. No bounding. Here, tibial, posterior tibial, and the popliteal. Okay, so it's good. Now I'm gonna assess for the overall arm. Okay. Skin is dry. Okay, there's no dry and warm to touch. There's no abnormal discoloration. Okay, good. Then next, we're gonna do the range of motion. So with the toes first, flexion, extension, hyperextension, abduction, adduction. Okay, good. Now we're gonna do with the ankles. Okay, I'm gonna assess your ankle first if there's any redness, tenderness, swelling, crepitus, nodules. So it's good. Now we're gonna do the range of motion. Okay. Flexion, dorsiflexion, plantar flexion, inversion, aversion, and then rotation. And then I'm gonna test for the strength. So try to dorsiflex, dorsiflex, dorsiflex. Okay, plantar flex. Okay, good. So it's 5/5. Now I'm gonna do to assess the light touch sensation. Okay, so it's the same that what we did in the upper extremities and now with the lower extremities. Okay, so it's gonna be the same. So with the sharp or soft. Okay.
Hey, sharp, left leg.
Okay.
Soft, right foot. Sharp, left leg.
Okay, good. And now we're gonna check for the assess for the vibratory sensation. So it's gonna be in the medius malleus.
Okay, stop.
Okay, so it's good. Okay, so I conclude my examination. Everything is great. So do you have questions for me?
No.
Okay, so thank you and have a great day, okay?
Thank you very much.
Thank
Appreciate it.
you.